Good evening. How are you? This is Dr. Gerald Thompson with Your Health Matters. And last week, and let me just say, Kamal, could you double check for me when NDP is launching the manifesto and so forth, please? Yeah. Yes. Last week, I said that, the political season, it's nice to discuss some of the health issues of a specific disease. But I thought it was also important to go through what are the plans for each particular party. I don't think that the NDP has launched its manifesto yet. So I'm keen on that. And next Wednesday will be the day before election. I will have to draw some mention of it, or maybe on the morning program, I might draw some mention of it if that launch occurs. I think the launch may take place either later this week or on the weekend or so. I know it's supposed to be taking place in Barely, but I'm looking forward to it. But I wanted to touch on what plans the ULP has and to look very carefully in the manifesto on page 39. And for those of you who do not have a copy of the manifesto can be obtained electronically at voteulp.com. You understand? Voteulp.com. Now, what is a manifesto? A manifesto is really a public declaration of policy and aims, especially one that is issued before an election by a political party or a candidate. In other words, you can have a national manifesto or you could have a candidate's manifesto. Each candidate could put out a manifesto for their constituency, or a party could put out a manifesto for the whole nation. And once again, a manifesto is a public declaration of policy and aims. Now, on Monday, somebody asked me, they went through the manifesto and they couldn't find how all these projects were being paid for. Kamal, if you understand, they couldn't find out the costing of each particular project, each idea. Well, the manifesto is not a budget. It's not a business plan. It's a public declaration of the policies and aims you're looking to achieve within that 5-year period. And it acknowledges that some things you will achieve in a year, some things you take the full 5 years, and some things you may have only started in that 5-year period and not yet completed. You understand? But these are the policy initiatives. And the ULP said they are retaining 500 copies that they are going to be distributing to senior civil servants, so that senior civil servants truly understand the policies of the next government. Now, I imagine that if the next government is the NDP, that they will have their own set of policies. But I don't anticipate that any party is going to, at the back of it, have a costing of each project and say, this is going to cost so-and-so billion or millions over a 5-year period, and it will create this amount of income to pay for it. We'll get the money from here. You don't need to do that. And that, I think, was an error on the part of one of the callers, and I understand, And it's not a function of a manifesto. You won't find it in a manifesto because that's not the purpose of a manifesto. So I am looking forward to the NDP's policies on health because so far I know very little. What I do know is that the NDP has said that the acute care hospital being built at Arnesville should not have been built, that instead there should have been a reconstruction of the hospital in Kingstown. And a policy has been made that because of the old colonial structure, where they've tried to fix different sections of a wooden building, turn some of it into a concrete building, that this is an old building that is going to continually leak, that is going to be continually prone to floods, that is going to be near a cemetery and has certain social and psychological issues that people have talked about for decades. But at the same time, the Kingstown Milton K. Memorial Hospital has some great advantages. There's an excellent pediatric center there that millions of dollars was pumped into in the downstairs of that hospital. And it is a state-of-the-art facility that essentially provides care for persons who are kids, youth, newborns. The Milton K. Memorial Hospital, when it is eventually repaired, is going to become not just a childhood hospital, but also a maternal hospital. A maternal hospital dealing with pregnancies, dealing with high-grade pregnancies, problems of pregnancies, and providing people with care how to avoid pregnancies, how to manage pregnancies, and getting families involved in that whole type of issue. It's going to offer, do you know if you have sickle cell? Do you know if you have a trace of sickle cell and you have a relationship with someone else, a woman who has a trace of sickle cell, we call it a trait, that you could produce a child with full-blown sickle cell. That sort of information needs to be known. That genetic information needs to be known and advice given to people. And so that maternal hospital is going to be well known. But the NDP had said they wanted to have everything at the Milton K. Memorial Hospital and not build this new hospital, which is going to cost almost $200 million. I could be wrong, right? And that's something that they are going to privatize. And I'll come back to that. They're going to privatize that hospital and literally go to some extent in terms of privatizing healthcare. Now, what is the ULP looking to do? And the talk of the health and wellness revolution has brought transformative progress to the delivery of healthcare in St. Vincent and Grenadines. Now, some persons may disagree with that because, we look at hospitals and healthcare on television and we see Dr. Hauser, Dr. Doogie Hauser, we see all sorts of different programs, and we see things that build our imagination of what things would be like. I'll tell you, I've seen that. I've seen that in New York. I've seen that at some of the best hospitals in New York City. But I've also seen some things take place in other parts of the world that would make you shudder. And the lack of medicines, the lack of medication, the lack of surgeons. If you need a surgeon to do some surgery, But you then have to instead have someone else who has never done that surgery before do the surgery. You could understand a lot can go wrong. If you don't have a surgeon in an area, but surgery needs to be done, someone has to do it. Someone has to do it, or the patient dies. But as a result of somebody doing it, patient could still die. Whereas what one would like in an ideal situation is that you have the expertise right there on the spot to be able to do it. And so some persons may be looking for high-level state-of-the-art care, as is seen at the Mayo Clinic or Columbia Presbyterian worked, the Methodist Hospital, and some of those particular places. And it is said that when the ULP took office, St. Vincent Grenadines had only 3 state-run pharmacies. 3 state-run pharmacies. Today, there are 42. You know? And that today, there's been the introduction of CAT scans, MRIs, cancer care, dialysis service, even free transport to the dialysis service, all of which were previously unavailable. You know? Now, there's always been an emphasis that we should do prevention, you know, is better than cure. Prevention is better than cure. And the ULP is saying that they see healthcare as a right and universal access as a cornerstone of our social and economic development. They believe the opposition, by contrast, has pledged to privatize healthcare, so restricting the high quality, more expensive care to that of the wealthy few. And the NDP's 2020 manifesto openly supported privatization, a position that persons in the leadership, I would say Sinclair Leacock in particular, have reaffirmed. They're going to privatize the healthcare sector and certainly privatize the major hospitals and so forth. And ULP in their manifesto says, as a promise, every Vincentian deserves timely, affordable, and high-quality health care regardless of their income or location, whether you're rich, whether you're poor, whether you live in the Grenadines, Fancy, Kingston, or Chateaubriand. And they will be building a modern, responsive public health care system that grows and adapts to the needs of this country, that grows and adapts to needs. And what that says is that it isn't going to be like a magic wand. It isn't going to be a Cinderella where the coaches and the glass shoes, all the things are created. No. What it really means is that it's going to be built over a period of time as the budget and as the emphasis is. So the main plan then, is universal access and equity, investment in infrastructure and human resource. That's important. Not only we have the infrastructure, but the human resources, adequate nurses, the type of doctors, the type of specialists, and also the type of access to international specialists who may be able to do work over the internet, or if things can't be done here in St. Vincent, the referral to other places, whether Cuba, whether South America, Barbados, Trinidad, or so forth. And then the digital innovation and the use of technology in healthcare. This is so important. You know, today, I could be running a clinic from here and seeing patients in Chateaubriand. You have seen me on this show when I've been overseas. And really, I can tell you that from time to time, I have been able to even maintain and see patients in New York, some patients that I've had for a very long time. And I have the system I could see them using online, StreamYard, where someone else is examining them, because I can't examine them. We haven't reached that stage where I could examine them electronically, but somebody could examine them and tell me what they found, and I could watch and see and ask them questions and put the thing together based on my consultancy and my experience and so on. You know, it's always better if the patient is in front of me and I could see the patient and feel the patient, examine the patient and ask questions to get answers straight away. But if that can't be done, the next best thing is to do it remotely. And we've now been able to achieve that remotely. Surgery can be done remotely. From someone in Virginia doing surgery here with special electronic robotics and so forth. It is being done all over the world. And then, you know, preventative healthcare and wellness promotion. That's so important because you can't be just dealing with everybody who's just sick. You got to promote wellness. And then addressing the broader determinants of health. That's big. I'm talking about the broad determinants of climate change, the food we eat, some toxic food we eat, the things we like and we shouldn't be liking because it tastes sweet or they taste salty, you know? The things that are promoted to us, the Coca-Cola and all them kind of things that are heavily promoted to us, billions of dollars spent in promoting us to drink that stuff so the billion-dollar companies could make more billions and our health suffers. And then preparing for public health emergencies, you know, preparing for COVID, preparing for another disease, another pandemic. And it's strange, you know, people say, oh, if you're preparing for another pandemic, that means you're going to make one, you know? Bill Gates had said we should prepare for a pandemic. So therefore, a lot of people felt, since he said so a few years before, he must have engineered a pandemic. You know, he engineered the pandemic to prove the fact that he was saying he was right and he could make an extra dollar. That ain't what happened. That did not happen, you know. But one could go on and on, you know. It's important that we recognize in St. Vincent what we've done. So far, we have a series of community clinics. Clinics in Rose Hall, clinics in Spring Village, clinics in Coast Hill, in Chumuka, clinics in Chateaubriand. And what that means is that these core clinics are important. And then we have a series of polyclinics, you know, polyclinics and hospitals, polyclinics and small hospitals. You have a polyclinic at Buckament, one at Stubbs. There was a polyclinic at Mespo, but it's really the Levi Latham Hospital. There's a hospital in Chateaubriand, one in Georgetown. And then you have super hospitals such as the Modern Medical, Milton Kate Memorial Hospital. And then at the top of the list now, what we're going to have is the acute referral hospital that I'll come to in just a moment. So our future must be a healthy one. And it's important, let's just go over some of the things that have been done before we talk about. They've been rehabilitating the Milton Kate Memorial Hospital, including the female wards and so forth. But you know what? The place still looks horrible. It's known. But you can't properly renovate something where patients, if you move out all the patients, put them somewhere else, then you could do it properly. The dust and the cement and everything like that. But it's difficult to do it and hang up cloth and screen it off and try to do it so that the dust you're preparing doesn't go into a patient's lungs and cause problems. Really and truly, we need another structure that patients could be temporarily transferred to, just like we did with the port. You know, you couldn't go and repair an old Kingston port. You needed somewhere else. Now that you have a new port, you could now repair that for cruise ships and all sorts of other things. So the Milton K. Memorial Hospital needs to be ongoing. Then the construction of the acute care hospital. This is such a beautiful hospital. And some people say we're wasting space, but the space that's been dedicated, certain sections are going to be 2 floors. But really, it is going to be predominantly ground floor based, whereby you don't have elevators that are breaking down after 5 years. I have been in hospitals in other parts of the world with a patient inside that elevator, and the elevator stops, and the patient is inside. It's also happened when I'm a doctor inside there, or the nurse inside. We can't get out for half an hour, a couple hours, but we're supposed to go and do something. Imagine we trapped there all day. Imagine the same patient is trapped all day because they can't get the elevator. So you want to still have some things like elevators, ramps, and other things like that, but you want to minimize a lot of those expensive electronic things. So the acute care hospital is sometimes called the acute referral hospital. Kamal, you've heard it being called acute referral hospital? It's really called acute care hospital, acute referral. What it really means is that you're not going there to get a vaccine. You're not going there to get an ordinary bandage changed, you know? You could have that, but that's not going to be their emphasis. Their emphasis is on Gerald Thompson, who's had his heart attack. The emphasis is going to be Gerald Thompson, whose kidneys are failing. This is Gerald Thompson, whose bowels are blocked, you know, who has stoppage of water and he can't pee. It's Gerald Thompson who's been burnt, skin is burnt. He's got 20%, 30%, 40% burn. It's also about Gerald Thompson went diving in Bequia and he come up too fast and he has the bends. And a helicopter is going to take him from Bequia and fly him to the acute referral hospital in rapid time, a few minutes. Or if I was in Union Island, flights there too, or flights from Chateaubriand or Soufrière or somebody who basically has been injured, who fell off a bank, who fell off the crater. You fall along inside the crater. Have you heard anybody happen to anybody come out? Huh? No, it hasn't happened. But imagine somebody falling off something, falling off of a 3-story building and being injured, crushed, broken, multiple broken bones. You need them to get to the hospital very quickly. You might need a helicopter. So the acute referral hospital will have a helicopter pad to receive patients that are coming from like the Grenadines or from afar or very serious. And there will be a helicopter associated with this hospital. That's how much equipment that's going to be available. You're just buying a crane, you're buying a helicopter, a Medivac helicopter at the same time. The acute care hospital will have doctors who are experts in their field. Some will come from Cuba, some will be local doctors, but specialists who will be able to take care of a much wider array. It will have another MRI, another CAT scan, its own laboratory to do things quickly. It will function 24 hours a day. And people who have been stabilized in a clinic or in a polyclinic can be referred to this acute referral hospital. This acute referral hospital will also pose to be a regional entity. In other words, it will be so good that people from other islands will be coming to St. Vincent to also have healthcare, likely at a different cost rate, Not necessarily the same cost rate, but that's all those things have to be looked at. So the acute referral hospital is going to be the pinnacle of healthcare, looking to resemble that of what you might even be seeing in television. But at the same time, we're not going to forget about preventive health care. You have to prevent the disease, not just cure it. So then they're going to also rebuild the mental health center in Glen. There's been some renovations done on it. That was something that was burnt. I think there was a fire there and so forth at some point in time. They did quite a bit of repairs, and they are going to do some substantial construction of it to provide individual rooms. You know, at the mental hospital, Kamal, do you know at the mental hospital, it's still open air where people live to get bunched. If I had to go to the mental hospital, I know somebody would make a clip of this. I would want to have a private room where the private care and so forth could take place. I'm saying that because I did a year of psychiatry, and I have had to take care of a number of psychiatric patients. And it is important that each patient has that individual care, and finding a private room and so forth can be very important for that. You know, so when I say Gerald Thompson needs that, I know somebody will play with those words. I know people will play with that and cut some tape and say, you know, Thompson needs to go mental. I expect that. But, you know, I'm sensitizing things so that people could talk about these things. I'm throwing these things out for people to talk about. And then we have to build additional polyclinics. We built the polyclinics at Stubbs. What I said earlier on, they rebuilt the mental hospital. I know they plan to do more. They basically built polyclinics at Stubbs, Mespo, and Buckingham. They basically rebuilt the rural hospitals in Georgetown, Chateaubriand, and Mespo. Some of these going as smart hospitals. And they purchased a medevac vessel to expedite patient transport from the Grenadines. So you know there's a boat, there's a medevac vessel, the transport people, all these things have been done already. The introduction of CT scanner and MRI, all that's done. The installation of a hyperbaric chamber for people who might have the bends from diving, if you dive and come up too quickly. And they build the modern medical and diagnostic complex in Georgetown. They did that, you know, they built that. And that's really been a buzz. That's really been wonderful, well managed. And so, you know, they partnered with the World Pediatric Project to make St. the center and the hub for pediatric care in the OECS. And they also send people abroad to Virginia for other surgery. But imagine that kind of surgery, people from St. Lucia and Grenada and Dominica, even Barbados coming here for World Pediatric thing. That's happening as we speak. You know, they've eliminated mother-to-child transmission of HIV. You know, can I tell you, in 1997, I was part of a team looking at this whole thing. And I'm really so glad this was in Newark, New Jersey, as an infectious disease specialist, looking how we could prevent maternal transmission. Here in St. Vincent and in other parts of the world, they've achieved it. In St. Vincent, they have also achieved it. In terms of build a temporary elder care facility and demolish the antiquated Louis Punnett home for the elderly while completing designs for a more modern permanent structure at the same location. The construction of the Belair, Byra, and Enhams Clinic. They did all that. Collaboration with Cuba, Venezuela to implement the hugely successful Vision Now eye program. A lot of people went off to Cuba. Come on, you remember that? People went off to Cuba for Vision Now, get all the cataract, the pterygiums, and the glaucoma fixed up, laser surgery, and so people got some really great improvement in that. You know, complete the design of the Calico Polyclinic. They did that already, but it hasn't been built yet. And publish the patient's Bill of Rights and publish an introduction of chemotherapy and dialysis here in St. Vincent. You know, long ago, you had cancer, you had to travel. Now there's an oncologist, a great Cuban oncologist here, a couple of them, and they're doing some wonderful work with cancer, especially colon cancer and dialysis. I must tell you, you know, they introduced dialysis, and then recently they had free transport for dialysis. I must talk about this. I own a bus, and my bus for at least a month and a half was participating in the transportation of those patients for dialysis. I made a number of good friends. I wasn't the driver. My driver, Michael, did a really great job in doing that. Now the government has taken over to continue that particular process. It's a wonderful program. And so I'm glad that I was part of helping to get that off of the ground. Patients getting free transportation for their dialysis. And the dialysis is also free. That's amazing. You know, when kidney patients used to be killed, there was a gentleman named Michael Hamlet who died of kidney disease. He didn't start getting dialysis at all. But there are lots of people. My good friend Dason Henry out of England used to come down and try to persuade that we could get this done. He would be smiling today to know that it's been done very effectively, and at the same time, it's free, and the transportation to get the dialysis is also free. You know, that's all been achieved. Now, what also been done in health is to enhance the delivery of water. You know, do you know Vincentian water is the best water in the Caribbean? In England, they pump water from the sewers, filter it, get rid of all that muck stuff that's in the sewers, and strain it and do osmosis and so forth and get some pure water, pretty water. Of course, I don't drink that. You know what I mean? I never drink that tap water in England. You know? In other parts, I remember went to a place in Pennsylvania, and they told me that the cancer rate in the area, because the water comes from wells in the ground where there's radioactive substances that come through the water, and everybody drinking it. I ain't drink it. And then bottled water sometimes. The bottled water, you leave the bottles in the sun, the plastic starts to get shaved off, microplastics, drinking. We don't as yet know what the effect of microplastic, but we know it's bad. We know the microplastic is bad, but we don't know what it's causing that's bad yet. We will find out. I think our gravity-fed water is pure. Every now and again, you turn the pipe, you see some mucky stuff, let it run. After a while, boy, that water is so sweet. And then there's a mineral springs around that are absolutely wonderful. So what is the ULP looking to do, it seems? They want to complete the construction of the acute care hospital, right? And that's expected to be completed by 2027. Now, the hospital is being built with a loan from Taiwan, a very concessionary loan from Taiwan. And if we change diplomatic relations with mainland China and get rid of Taiwan and endorse, then guess what? There will be no more diplomatic channels to transfer monies. They will demand their monies for that loan up front. We'll have to come up with the money that is being used to build that particular hospital. What that will do, the hospital will probably have to stop being constructed until we can refinance, find some other source. If under the NDP, sell some passports or get some money from mainland China or something like that. That's what we like it to be. You have to sell a whole ton of passports to get the money to basically pay for that, right? So that we will also complete the construction of several polyclinics in Belair, in Byra, Calicut, Central Kingstown. This is something Sinclair Leacock has been asking for a long time. There was a view that the Kingstown General Hospital, the Primitive Memorial Hospital, was adequate for Central Kingston, but in truth, going up in Sharps and Green Hill, there is probably a need for a clinic there in Central Kingston to cater for those individuals, and they're not necessarily having to reach down to the casualty or hospital there. And there are also Paget Farm and South Rivers. These are going to be major clinics and polyclinics to be built there. Complete constructions of the Enhams Wellness Center. I've been very close to this. It's close to the MCA. And this is a center in which persons are going to be able to go there and learn about exercise. Go and learn about dieting. You will be able to participate in the gym, and your group, your hypertensive group, will be there with a trainer. You come and you're doing exercise and so forth. Persons who are overweight and obese and so forth, you could start finding out more about how to reduce your weight and be given the right type of care. There'll be cooking classes there for certain people to learn how to manage these sort of things. And that wellness center is going to be really important. Enhams, up in East St. George, there's a road from the highway going up into Enhams, going up in that area there. Establish healthy education lifestyles. You hear what it is? This is a program called HELP, Healthy Education Lifestyles Program, HELP. It's going to tackle non-community. The amount of people today who still think salt is good, mainly youths. Come out, did a study and found out that 15% of our youths think that eating a lot of salt is good, is better for you. You know what I mean? And the type of food we eat, and so all these things are going to be important. Education. Then, in addition, begin construction of a modern geriatric home and care facility at Glen. Now, the difference, we've always talked about poor home and so forth, but they're talking about a modern geriatric home. This is not going to be a poor home. This is going to be a geriatric home. And it's going to have many, many beds. Yes, a lot of people who will be there will be persons who are poor, but it isn't going to be, it's going to be treating these elderly persons with respect, not based on how much money they don't have, but basically as an elderly. So it's going to be a major elderly facility, right? And then reform the delivery of mental health care to focus on more preemptive and outpatient treatment. There's not enough of that, and we need to emphasize what's going on in communities and so. Double the size of home health. Do you know there are people who are home health for the elderly? So come out, do you know about this? Home health for the elderly. Yeah? They're going to double. They have about 40-something, maybe 40-something people, maybe 50, 60 people. We're going to double to over 100 and something people. That's a wonderful program. So they could take care more and more of the elderly person. They're going to provide extra facility in all the polyclinics. They're going to guarantee the presence of an ambulance at every polyclinic. So Buckingham Polyclinic will have an ambulance there. Stubbs will have an ambulance there. Mespo would have an ambulance there. And the new polyclinics at Belair and so forth, they're also, the polyclinics at Belair, at Calicut will also have an ambulance there. And guarantee the presence of an ambulance, I mentioned. A fully digitize the healthcare system. This is the health information system. This has been taking some time, but basically I'm sure it's gonna be done. Expand dental care, and then secure more scholarships for Vincentians to study medicine and other disciplines. Come on, I'm going to apply for it. I want to study medicine over again. I want to study medicine over a second time. I wonder if they will allow me to study it over so I could pick up on some of the more modern techniques and so forth. You know what I mean? And then formalize existing ad hoc arrangements with the governments of Cuba, Guyana, Trinidad, Tobago, and Venezuela to ensure Vincentians can get tertiary access. I want to add Colombia to that too, you know. Establish a healthy youth unit. Look at that. Establish a healthy youth unit to conduct outreach, you know, in treatment and so forth, and restructure the relationship between the consultant doctors. This is something that's been, they're saying that the consultant doctors, some of them are referring patients from the hospital who might seem to have a little bit more money to their clinics. That's an interesting put in the manifesto, but it looks as if they are looking to address this problem as a policy issue. And pass a new pharmacy act to better monitor and regulate pharmaceuticals and improve regulations in terms of the oversight of the clinic, the management of hospitals, the administration of hospitals. There's a lot of stuff there. We have 15 minutes. I don't know if any persons will have any comments. I'm unable to do my comparison with that of the NDP's manifesto right now, but I'm sure I'll get it and I'll be commenting on what they have produced. But since the ULP has come out with theirs, and if you want to look at it at voteulp.com, you just download it, and so it'll be available to you, so you could check it out. Kamal, I don't know, any questions, you know, you want to put to me and so forth, anything you think that really they should be addressing and trying to address here in St. Vincent, you know? You know, it's not your field, right? It's not your field, really. You know, I want to really stress that the establishment of a healthy education and lifestyle program, HELP, is so critical to tackle non-communicable diseases. That I mean, high blood pressure, sugar, kidney problems, arthritis, and also obesity and heart disease. This stuff is so critical. And I don't think people realize how much healthy foods we have. I also am of the view, and what this does touch on, is our ancestry. We have to bridge the gap. During COVID, we had people drinking turmeric and ginger. Was that good? Hell yes, it was. It was damn good. And these things should be encouraged. Because of the research into other things like guava leaf and soursop leaf and aloes and noni, and so the word is out still on what really should be done, how much these things could be incorporated into medicine. But I think that there's room for them in our culture, and they need to be promoted more. You know, I think that in terms of also the health structure, they have it here, the maintenance of buildings, you know, the painting of them and maintenance of them to keep them up so they don't deteriorate is going to be critical, right? But, Kamal, let me say, in a manifesto, there are some people who look for different things. The page on health, they may skip over, because a lot of young people may well skip it over, go for other things, maybe go for the youth manifesto that they're coming out with. And other people who are into construction, roads, they want to see what's being done there. But health is something that we're all affected by. It's so unpredictable. We don't know when it's going to affect us. One day we're okay, next day we're in bed. Whether it's the flu, and we're hoping it's just the flu. If it's the flu, 2 days later, you bounce back. Fluids, juices, all them kind of things. Some soup, some boiling and all, you're all right. But boy, if it's not just the flu, it's something else, some other thing, some strange disease. You want to know that the expertise is here. We lose a lot of time. And when experts are not around, bad decisions could be made. Wrong diagnoses are made. People placed on medications that don't help but could hurt. And this is something that happens all over the world, all over the world. But I am looking for St. Vincent to really stand out. When this manifesto calls for St. Vincent to prepare to become a third world nation in 15 years, the provision of health at an excellent health facility is part of that, And the system we have in St. Vincent, where you have a major acute care hospital with two big efficient hubs, the Modern Medical in Georgetown and the Milton Cato Memorial Hospital in Kingstown, dedicated to pediatrics and maternal care. And then you have polyclinics around, 5, 6 polyclinics. Then you have several hospitals in the Grenadines, in Chateaubriand, in Mespo, and you have all these other clinics that people are able to go to. So people have access to healthcare. And the question is, how do you fund all this? I was speaking to somebody today who said, I went there once and I had to go and carry in some toilet paper. And I've brought this up because I knew of the situation. Now, I remember being at I'm not going to directly refer to St. Vincent, but I remember being at a hospital in the United States, and they were having the same problem. And there were some members of staff. What they were doing was taking a few of the toilet paper rolls, 4 rolls, and a couple of sheets, and a couple of other things, some of the liquid soap and things like that, taking them home with them. So one nurse took 4, another one took 4, another one. And let me say, I didn't say me nurse, sorry. Let me create stuff out. Some members of staff taking 4 toilet paper, some sheets. And over a period of time, they found that they couldn't keep up. And there were times when, anytime they had an outbreak of diarrhea and they were using up the paper, they might run out of toilet paper. And I have heard the central stores lament, boy, we distributed so much of these things and they're saying there's none. Where have they gone? And people get the impression they haven't bought it. There's no money to buy it. And so that's not the case, But also, I want to say that the purchasing has to be accurate. I know, like, I put milk in my coffee, but I pour the milk until the milk has run out. Then I got to go back to the supermarket to get more milk, more canned milk. I would miss it a couple of days, miss my coffee without milk. How do you bridge the gap that you always have covered? In other words, if you buy 3 cans of milk, when you reach down to 1, you buy it then, right? But we don't do it that way. We don't always do it that way. The supplies are not always purchased well beforehand. Sometimes they are, and guess what? The people who are supplying will tell you, boy, there may be some delay, or that the boat ain't come through the Panama Canal, or there's this or there's that. And when we had COVID, you could imagine the kind of disruptions and so that took place around the world in the supply chains. But what I wanted to do this evening, and I anticipate I may not have gotten many calls because this might be along a political line, but I promise I will try and get a copy of the NDP manifesto, whether online or a physical copy like I got this. And I will try and review it and read it through to see exactly what it might mean to you. I want to again highlight something. The acute care hospital is a vital entity. And today, you can get a CAT scan and an MRI anywhere from $800 to $1,200 going on plus dollars. The MRI in other countries would be upwards of $5,000. In terms of your hospital stay, if you stay 10 days in a hospital, you will be asked to pay $100 at $10 a day. Now, somebody may think that should be increased, but there are a lot of people who go into hospital who can't even afford that, you know? And you may say, well, have a two-tier system, one for the wealthy, one for the poor. That sets up a kind of discrimination. The policy of the government is to have an equality, equal situation that we talk about. You know, that's really important. Equality. And that is important, that whole concept of equality. And that's the first principle, universal access and equity. Universal access and equity. And equity in that sense is going to in relation to equality between different types of people, whether you're from north, south, east, west, whether you're tall or short, whether you're rich or poor, or socially, unable to provide care for yourself and so. But if the hospital is privatized, what that means, and I said in the NDP's manifesto for 2020, they say they're going to privatize the healthcare system. Hand it over to doctors? Well, no, they're going to hand it over to people who want shares. Now, what will happen is that there will be a board, and these people who have shares will contribute to the policies of that board. And what boards under these circumstances typically do, they increase your fees. So the $10 a day will increase to $100 a day, so that somebody who spent 10 days in a hospital doesn't pay $100 but pays $1,000. The chest x-ray, blood tests, all these things are so cheap. They will triple, quadruple those prices where you have to pay more. And I could go down the list of a lot of things. The cost for chemotherapy, the cost for dialysis. You think that they could continue having free transportation for dialysis? Free dialysis on a privatized system? No, can't be. Folks have to pay for that. And what it means, what typically happens, is that the wealthy will find it easy to pay. A guy like Gerald Thompson will find it easy. I could pay. Let me tell you, I could pay. But the average Vincentian, many of them may find a struggle to pay with increased prices. And so we're back to people with a sponsored sheet, walking up Kingston under the post office asking, can you give me a donation so I could get a CAT scan? Give me a donation, I could get an ultrasound, I'll do some blood tests. I need to raise the money and so forth. That stuff has been virtually eliminated. You hardly see that anymore. You know what I mean? You don't see that anymore. People with a sheet, a sponsored sheet, or bake cake sale and so forth on the singer, trying to raise some funds to go to Barbados or go to Jamaica or go somewhere to get something done. A lot of those things has been done here. People still go overseas, no doubt. People still go overseas, but a lot of them have been done here. And the healthcare system means that if you get severely sick, you don't have to sell your house. You don't have to mortgage your house. Your beloved wife gets sick. Your firstborn daughter gets sick. You're obliged to find out money somewhere. We basically, in the past, had to go with sponsored sheets or sell your car, sell this, sell that, in order to get money to basically get your child some health care. Today, those things have phased out. We've kept the prices down. People say cost of living is about food, yes, but cost of living is about water. With the cheapest water here in the Caribbean. Come on, you know that? And we have the highest quality and the cheapest water in the Caribbean. Water is medicine. Water is life. And then the tests at the hospital and clinics. You could go now to many clinics. They have machines that could do the test on the spot. And basically, you could know your results, your sugar level and your blood pressure level and your cholesterol and all those things straight away. That equipment and so is available. And certainly CAT scans and so forth, which are very expensive machines, need a lot of maintenance, do need to have some payment done on them, but they ain't $4,000 or $5,000. I want some people, you will be able to read lots of other sections on different programs, but for Your Health Matters, I want to say I like what the ULP has put in their manifesto. I look forward to seeing what the NDP is doing and hope that they wise up and don't think about privatization of our healthcare system, selling it off just because CBI is no longer an option, that they're going to find money by selling off assets. I don't really like that. I think these institutions, the hospital, the port, the Argyle Airport, and other things like that, can be vital to St. Vincent's growth, and as has been happening, especially with the airport. Ladies and gentlemen, the hour's up, all right? And nobody, there may be some comments on this. This is Dr. Gerald Thompson signing out. Your Health Matters. Thank you.
Your Health Matters.
How much do you know about what makes up a healthy life?